I will show you the flowchart for well-being and health in home. This illustration of flowchart is composed of 3 critical parts of criteria. Well, I described the physical environment. These parameters range from metrics that can be used to evaluate dwelling design through to neighborhood design, going from top to bottom, with metrics that apply to both sitting in the middle, and are divided into quantitative and qualitative metrics. Techniques and guidance for measuring environmental parameters are well established across the industry, and detailed guidance exists for the evaluation of lighting, daylight and sunlight access, indoor air quality, humidity and temperature, and noise within the home. Guidelines for space standards also exist, alongside nationally approved methodologies and software for calculating energy costs. Environmental impact assessments (EIAs) cover most of these. Quantitative metrics for neighborhoods, and the planning process has its own metrics for density and public space. Given the significance of public space in realizing mental and physical health outcomes, it is recommended that qualitative aspects are also considered. Using tools such as the Merton Open Space Strategy (MOS) evaluation criteria to make a qualitative but systematic assessment. Climate change resilience can be explored using a range of modeling techniques. Flood risk mapping is available via the Environment Agency, and projected weather data files for analysis of the effects of climate change are available for modeling overheating, as well as predicting future heating and cooling energy requirements. Environmental assessment methods such as BREEAM, LEED, and the new Home Quality Mark developed by the, as well as the recently discontinued Code for Sustainable Homes, also offer guidelines and metrics for the measurement of design parameters. These include assessment of qualitative aspects, for example using surveys or checklists with very specific descriptors to ensure consistency of measurement. These need to be accompanied by commentary from experienced assessors or researchers.
Let me illustrate health and well-being outcomes. These range from metrics that are experienced at an individual personal level through to outcomes that affect social relationships, going from top to bottom, with metrics related to productivity sitting somewhere in between, and are divided into objective and subjective metrics. Objective metrics are quantifiable indicators, often applied to physical health, but also includes established tests for cognitive functioning. Subjective metrics cover self-reported or perceptual issues, for which, despite their more fuzzy nature, there are some well-established data-gathering techniques. The flowchart also attempts to highlight the fact that the measurement of health and well-being has 2 dimensions. The measures for ill health sit alongside measures of well-being or flourishing as well. Absence of illness does not necessarily mean that a person is happy and well. There are a range of measurement techniques for these issues, including post-occupancy evaluations, personal fitness devices, smartphones, large-scale surveys, medical tests, aptitude tests, environmental monitoring devices and sensors. Firstly, smartphones and wearable devices are able to record many things from movement and location to a number of hours of deep sleep. These devices, along with environmental sensors, are catalyzing a move to greater data visibility, providing real-time feedback on how well indoor environments are meeting people's needs. In the near future, we can expect devices capable of carrying out far more advanced analysis of everything from your sweat to your mood, maybe even from inside your body. The public health sector has many measurement techniques for measuring both physical and mental health outcomes. A typical full NHS health check would include carrying out a rigorous personal history interview including questions on smoking status, alcohol intake, family history and level of physical activity. The Warwick-Edinburgh Mental Wellbeing Scale (WIMPS) is one of the most commonly used subjective well-being measurement methods in the UK. Its shortened form is a good way to find out about perceptions of different environmental settings, which can act as a background indicator of whether the environment is a factor in well-being. There are of course many other measures of health, qualitative and quantitative, available, measuring things such as sleep quality, anxiety levels, and depression. But listing them all is beyond the scope of this report. Please take a look to economic value. These measures of value are divided into private and public sector value, ranging from metrics that influence personal financial outcomes, such as decreased healthcare costs or insurance premiums, to ones that relate to the sale or rental value of a property or development. We also include national societal outcomes, such as decreased public health costs and increased economic prosperity, through to mortality rates and life expectancy. This reinforces the idea that measurement can be carried out at all scales and by all stakeholders, and that the benefits of designing homes and neighborhoods for health and well-being can make a difference on so many levels.
Finally, you should go through a post-occupancy evaluation. A post-occupancy evaluation (PO) is an evidence-based study that seeks to find out how well a building performs and/or how well the occupants feel about their building. It is most commonly undertaken after a refurbishment or when new accommodation has been recently occupied. The study can help designers, developers, and managers understand whether a building is satisfactory from an occupant's perspective and whether environmental and comfort objectives are being met. The key elements of a well-designed post-study include both quantitative and qualitative aspects, built environment measurements using monitoring devices and sensors, and a resident behavior component as a minimum, questionnaires and surveys. The timing of the study is important. If it is undertaken too early, the occupants may not have had a chance to settle down and fully appreciate their accommodation. The study is therefore best undertaken after the occupants have become familiar with their new environment and ideally experienced both summer and winter conditions. The best studies include both pre- and post-occupancy evaluation, allowing direct assessment of any changes, using validated questionnaires and scales for subjective well-being, such as those in rooms and bus, not only ensures comprehensive analysis, it also provides the opportunity for national or regional benchmarking. However, whatever the questionnaire format, any study should aim to be independent in terms of asking occupants how well they rate comfort, daylight and design layout, etc. The BSRIA Soft Landings framework shows how PO can fit into an integrated approach to project procurement strategy that aims to deliver buildings that meet intended outcomes. The parameters for the study should be clearly set out from the beginning, to ensure consistency of the data and to provide a clear brief to all stakeholders and researchers. There is plenty of excellent guidance available on this topic, but as a starting point, the following aspects should be considered. What links are you trying to establish or understand? What health and well-being outcomes are you interested in? What is the budget for the PO exercise? What resources will be required from the organization carrying out the survey, and how much client and resident time will also be required? What needs to be measured, and at what intervals? What is the protocol for sensor calibration, and what is the mechanism for data download and sensor maintenance? During what seasons and for how long will the study take place? What dwelling topologies need to be covered? What resident types need to be covered? How will the residents be recruited? What incentives will be offered for participation? How will their privacy and data be protected? What rooms will be measured and where will the sensors be located? How will the data be analyzed? What outputs are expected and how will this data be used?